Good morning, everybody. It's lovely to be here. I'm very grateful to Farah and Jan for this wonderful invitation to come and share some thoughts with you. And thank you for your generous, if somewhat over-the-top introduction, Farah. I am really a psychological therapist. I'm a psychiatrist and a therapist who has worked with offenders for 20 years. I worked in secure psychiatric settings all my working life. And I've also done a little bit of work with trauma survivors. And I guess that work is part of what's informed the way I think about things. So what I want to do is just really share with you some thoughts about how we work with violent offenders, or how I understand work with violent offenders. I'm going to be focusing only on violence, not other types of crime. And I hope that what I'm going to be saying will stimulate some discussion. I also just want to mention another group that you might be interested in relating to, which is called the International Association for Forensic Psychotherapy. And this group is, as it says, it's an international group, been going for about 25 years now, which puts forensic therapists who are working with violent offenders together, but also have very active discussions with legal colleagues and colleagues in criminology and penology, because I do think that these types of dialogue are absolutely crucial for taking our thinking forward. So where I want to start is with a definition, and this is from a court case that was reported in the UK in 2011. I can't remember what the substance of the legal dispute was, but it had this rather nice line from the judgment which I thought was helpful, which is, "Violence is not a term of art. It is capable of bearing many meanings and applying to many different types of behaviour." And I think that's very important for us who work as therapists with people who've acted violently, not to assume that all types of violence are the same. And I think there is a very real danger sometimes that violence is seen as a homogeneous practice and that is the same in all circumstances and has the same meanings to offenders. I'm not even sure it has the same meanings to all victims. So I think that it's important to bear in mind that heterogeneous quality to violence. I'm sure these types of data is very familiar to you, but this is the type of violence I want to talk about. I want to talk about violence that uses weapons, fatal violence, violence that uses sexual organs as weapons, and assaults on the vulnerable, in particular children, but it doesn't. But I think the picking out of vulnerable people is, of course, a very particular aspect of violence that needs thinking about. I won't be saying much more about the interesting phenomenon that is the decrease of violence over the last 50 years. But I do also want to remind us, really, that when it comes to criminal law breaking, violence is an odd way to do it. It's an unusual way to break the criminal law. If you're going to break the criminal law, you're much more likely to take somebody's stuff than you are to physically attack somebody. Therefore, it seems to me that those people who do perpetrate acts of violence are interesting and unusual. The fact that they may be numerically frequent shouldn't confuse us. It is an odd thing to do to break the law by being violent. The commonest types of violence we know are basically assaults between young men, usually young men who are drunk or intoxicated in some other way. Certainly in England and Wales, that's still the commonest recorded violence that there is, with domestic violence very swiftly behind it. And I think that neatly encapsulates, again, how it's important not to see violence as one homogeneous concept, that clearly what is taking place in terms of young men fighting is not the same as what is taking place when a partner assaults a partner, and that these are two different communications that are going on here. The physical abuse of children is almost certainly underreported. When you do population studies, you get in the England and Wales we have prevalence studies of about 20%, but it could be much greater than that, we don't know. It could be much greater than that in some populations and not in others. But the reason that I labour this a little bit, and I'll come back to it, and I know that Adrian talked about this a bit yesterday, is that physical abuse of children is one of the most solid predictors of arrest for violent offences later. Therefore, if we were seriously interested in violence reduction, we would be wanting to do something about the physical abuse of children. And again, there's something here about relationships, I think, that is very important, and particularly those types of close relationships that we might categorize as attachment relationships, and I'm going to come back to talk about that later. But it's very striking, I think, that if you leave aside terrorism and violence in pursuit of drug crime, then what you're left with is relational violence. And relational homicide, according to the UN, accounts for 41% of homicides worldwide. And that's interesting. I think that should be interesting to us because it tells us there's something about relationships and the way that relationships are understood that may be important for violence perpetrators. I'm sure this is very familiar to you, and again, particularly if you had such interesting lectures yesterday, which I was sorry to miss. But the reason that I've listed these risk factors for violence here is because if we were thinking about trying to provide psychological interventions to reduce violence, we need to pick out the ones that we could work with. So clearly, youth, male sex are not things that we're probably going to be able to do very much about, or the youth will change in its own way. Social isolation is an interesting one and is, I think, very important when it comes to thinking about penal strategies. Paranoid mental states I'll come back to talk about, but paranoid mental states caused by anything are a risk factor for violence. Substance misuse, again, if we were serious about reducing violence, we would want to do something about substance misuse. Reality testing, and I'm going to come back to talk about that a bit because I think that that is a very important aspect of what happens in an act of violence and possibly in the run-up to an act of violence too, particularly those ones that are planned. That there's something about reality testing that I think may be important here. Hypervigilance is something that we think is probably associated with post-traumatic psychopathology, and I'll say a bit more about that too, particularly in the context of insecure attachment histories, usually in the context of child maltreatment. And then these antisocial states of mind that I think are where a lot of our psychological attention really wants to focus, which is a state of mind where you have contempt for vulnerability, where the sight of somebody's helplessness sort of energizes a type of hostility and cruelty, rigid types of thinking, and revenge. And I won't have time to talk a lot about revenge, but I think revenge is a very interesting phenomenon, and one that, again, psychologically is quite a complex one. And again, is a type of concept that it feels like it's something that is very simple to understand, but actually I think is quite an odd phenomenon too. Cultural risk factors for violence I won't say very much more about because, of course, as a psychotherapist, there's not much I can do about this. But it is important to think when I'm talking to somebody and thinking about what their experience of being a violence perpetrator is, clearly their cultural identity is crucial here. And I think there are some very important themes that will vary, of course, across nations and states. But the idea, most cultures have some stereotype of acceptable victims. And I think that, of course, is it from a legal point of view and sociological point of view is worth thinking about. Denigration of weakness, this often comes up as part of some particular types of masculinity. Fundamentalist ideologies that support the use of violence against people who disagree with your position. Tolerance of substance misuse culturally is likely to increase the use of violence, tolerance of violence generally. Access to weapons, which of course is a significant problem in many countries that have easy gun laws. And then the issue of violence by the state in terms of income inequality, which again I'm not going to say very much about because it's not an issue that I can deal with as a psychotherapist, but I think we would be foolish not to acknowledge the very strong evidence that links violence, homicide and suicide in particular, to disparities in income. This is the type of model of violence that I like to think about. So to take seriously these influences from different domains operating simultaneously and assuming that you have both, as it were, bottom-up or centre-out influences as well as external influences coming down. So a dynamic model of a violent mind. So what are the mental states that increase the risk of violence? Well, we know that relational rupture is an important risk factor for violence. And in this context, I have an image later on to remind me to mention, but I think it's helpful, I certainly find it helpful to think that in order for an act of violence to take place, you have to have a number of factors, risk factors in place. And some of them will be the risk factors we've already talked about. There'll be general ones like being male, being young, being socially isolated, being drunk, being intoxicated, those sorts of things. But for every violence perpetrator, it seems to me that there will be a couple of factors that are probably quite idiosyncratic. And one of them may be people's own histories of childhood abuse and neglect, but the other may be their relationships and the way they understand their relationships. And there was a study done nearly 10 years ago now, part of the epidemiological study of the use of alcohol and drugs in the community, this is in the States, which showed that obviously that substance misuse increases your risk of acting violently, but a breakup of a relationship within the previous year was also a potent risk factor for violence. And I think that's very important for those of us who are working with violence perpetrators, because often we don't take the kind of histories that elucidate that type of rupture. But a type of rupture of a relationship can have quite long-lasting psychological effects that are not always obvious superficially, but may have a big contribution to how people manage fear and distress. Clearly, threat perception is a key aspect of violence because of the types of violence that are driven by a reactivity to a perception of threat. So if you can divide hostility to others, violent hostility, as being proactive or reactive, in the sense of there's people who react to perceptions of threat. And if you have a low threshold for threat perception, that's going to put you at increased risk of acting violently. But perhaps the proactive people are people who are wanting to use violence in order to get their ends met, I think, that are also an interesting group of people. We can also think about reality testing. As I've said, I think that we have some good evidence that people who commit acts of violence are often have altered reality testing, have poor reality testing. Sometimes have built up a whole alternative reality based around their feelings and beliefs, which help to justify their actions. But your reality testing capacity, of course, has knock-on effects on how you experience stress, on how you manage your moods, on how you interpret inputs coming from other people. We think too that there are distinctions between violence that's full of affect and violence that's affectless, violence that's more planned and controlled and violence that's impulsive. People who are impulsively violent tend to come to the attention of mental health services perhaps more than others, but people who commit acts of planned violence are often seen as being, as I say, as being psychiatrically well. But of course there are some people who commit highly planned and organised acts of violence that are actually, seem to be quite abnormal, associated with quite abnormal thoughts and feelings. And then there's a question of how wound up people get, the way that people get aroused and physiologically agitated. We know that that has a big genetic component, but we also know that that's affected by early environmental stresses like abuse and trauma. So taking a history from people to get a sense of how they've lived with stress and how they've managed distress in the past is part of our assessment and formulation. So here are some more of the psychological themes that emerge when in discussions with someone who's committed an act of serious violence. As I've said, disturbances of reality, particularly a type of social reality in which other people are not seen as being real. That can take a frankly psychotic stance, sometimes with, for example, psychiatric syndromes like Capgras syndrome, where you believe that people have been replaced by strangers. But there are actually variations on that theme that are not so obviously psychotic, but have elements of that. People who are violent will often say they really weren't sure what was going on. They wondered whether this person was inferring some sort of threat. And I think what's characteristic of people who commit acts of, certainly some people who commit acts of violence, is an intolerance of ambiguity and an uncertainty around confusion, and a tendency, because it's intolerable to manage the anxiety of being uncertain, it's preferable to bring about a solution to that because it's intolerable. And that's related, of course, to threat perception problems and physiological arousal. Others who don't seem terribly real or human, and say an absence of consequential reasoning. I think it's often very striking that people will say that they really had, that nothing else will matter later because this isn't real, or that this is real but the future doesn't seem very real. And I think it's often very striking when you talk to people, particularly people who've killed, how little they anticipated what was going to happen next, that they hadn't really thought much past what was going to happen next. I think the wish to hurt and control, the wish to denigrate vulnerability is something that's quite hard to elicit from people when you first meet them. This is something that tends to emerge during therapy, and also includes the pleasure that was experienced by the perpetrator at the moment of carrying out the violence. And of course context is all important here, because when you're interviewing people who've been violent in the first weeks or months after the offence, often they're going through legal processes in which there's clearly a context in which they may not want to examine it, or they've got a particular cover story that they have worked together on with their lawyer. I'm not saying that's false in any way. It's very real for them, and it may be the truest thing there is at that point. But much of psychological therapy with offenders is about dismantling that cover story, dismantling that narrative, and then rebuilding a richer and newer narrative which takes account of agency, which takes account of the wish to hurt, that takes account of the satisfaction there was in committing the offence. But I think that it would be fair to say that many of us who work as therapists with people who've been violent start from the position that the violence is a type of communication to the victim, that it's not a very good communication, not a very clear one that you could wish had been expressed some other way, but there is an attempt to communicate something. And one of the reasons that we find this model useful as therapists, I think, is because one of the questions then in therapy is, has the message been delivered? Has the message been completed? So, for example, somebody who kills a parent in a disturbed state of mind is clearly, sending a message to the parent. But because this isn't a rational process in lots of ways, we can raise a question about whether that message has actually been delivered, has actually been completed. Has this person done the psychological work that they wanted to do by carrying out the homicide? Because if they haven't, then other people may be at risk. It's rare, but it does happen. So this is my reminder to share with you this idea about each act of violence as requiring a number of factors to be in place simultaneously. And this explains why you could have people who have a large number of risk factors to violence, but who are never actually violent, until the last number comes up. But the last number could be quite idiosyncratic, could be quite unpredictable, which is another reason why predicting acts of violence ahead of time, particularly things like homicide, is very difficult to do. I think that many people who are violent see other people as either a threat or they may see them as prey. And that victim-predator-prey type of states of mind, of course, we might think has some atavistic background for us in terms of understanding ourselves as potentially always being prey and the potentially being predators towards others. I think what's striking in the people I see, and I work both in prisons and in secure settings, but I think what is striking is how often, particularly in the early stages after an offence, is that perpetrators of violence will typically talk as if they have very little agency for what they've done. And that's part of those self-justificatory narratives that make it possible to act violently, in which you tell yourself that you're really having to do this because you're responding to a set of events that are beyond your control, and that it's important to construct a narrative for yourself in which other people have all the agency and you yourself really are being forced into something. And that, is, of course, is an interesting phenomenon in terms of the sense in which people need to see themselves as good people, rather than good people forced into doing bad things, as opposed to being a bad person. I think that those types of self-justificatory narratives decrease anxiety, which already we know is going to be difficult for these guys to tolerate. People like James Blair have suggested that we have a sort of violence inhibitory mechanism somewhere between the limbic system and the orbitofrontal cortex, but overcoming inhibitions to violence is an important part of acting violently, and that, of course, is probably where substance misuse comes in, as well as antisocial states of mind. And they say this disconnection from social reality, I think, is an important part of what makes a violent mind risky, because a sense that other people are not real or other people's minds are not real makes acting against them more likely. And I know you talked about this yesterday, so I won't say anything more about that. But clearly seeing other people as a threat seems to be very important in terms of reactive violence. And we think, again, that this is more likely in people who've experienced childhood abuse and trauma, who then experience themselves as being in states of fear and readily project those onto other people. People who see other people as a threat may get very angry very quickly, and as I say, in high states of arousal are likely to misinterpret various signs from other people. There is also an interesting argument, which is an old psychoanalytic argument, but I think one that has some interest, which is about identifying with people who've hurt you. So for boys in particular who've experienced physical and emotional abuse at the hands of their fathers or father figures, may well make a strong identification with those male figures, particularly as part of developing a masculine identity. And that often seems very hard for us to understand, but it's very striking when you see it, how people will talk about how much they identify with people who've hurt them. And Carl and Lyons Ruth in Boston has done some very interesting work looking at the attachment narratives of people who've experienced abuse and trauma, and how what often comes across are very powerful, positive, conscious identifications with people who've hurt you, which again then makes it all right in people's minds to hurt people later on. Seeing other people as prey, we don't see too many of these people in mental health systems, because people who have these states of mind rarely seek treatment and don't see themselves as requiring help. It's an unusual state of mind and hard to miss when you do see it. But it does seem to include really a failure to be able to mentalize or think about vulnerable states of mind, and certainly to feel any sort of compassion for that. Denigration of vulnerability and weakness is an unusual state of mind, and a risky one. And again, we do see this sometimes. People saying that it's pathetic to be in pain, it's pathetic to cry, those sorts of things. People who are weak deserve all they get. But there's an interesting interaction here, I think, with cultural stereotypes about acceptable victims. The whole concept, there's a whole concept in English hunting tradition, it may exist across Europe generally, the idea of fair game. The game that you are entitled to, those are the animals that you're entitled to hunt, and the animals you're not entitled to hunt. And I think there are very interesting, narrative representations of people who are seen as fair game. So, for example, it's commonplace sometimes to hear some groups of people talk about paedophiles as being fair game, that it would be quite all right to attack such people. And that's a nice example, again, of a type of cover story that people might put together. Why did you attack that man? Well, I thought he was a paedophile. I heard he was a paedophile, and so that's why I attacked him. And actually, if you break that down, you know, it'll become clear just how much there was no evidence for such a thing. But even the assumption that it's all right to attack paedophiles and that everybody agrees with that is in itself, I think, a type of reality distortion. Self-justification I've already talked about, but I think it is a very important part, a very important step in the execution of a violent act. I think that people who are acting violently need to tell themselves that what they're doing is fine and is justified. So they lack anxiety about this. Sometimes they're not interested in being forgiven because they don't need forgiveness because they're justified in what they did. Often that's again associated with stereotypes of gender role, stereotypes about dominance is right. You know, if I'm the most dominant person here, then I get to decide what happens, and that's just how it is. And you see that quite a bit, I think, in domestic violence perpetrators. Not all, but some. And then I think and what's interesting about this too is the extent to which self-justificatory narratives reduce shame. And shame is a very powerful emotion in offending. It is an emotion that both follows offending but also drives offending. And shame is very interesting in terms of both its cognitive and its affective aspects. The cognitive aspects are very much about social status, and we know from work by Bob Sapolsky and other primatologists just how important status is in terms of feeling in charge, of feeling good. But therefore shame is associated, I think, with very painful affects, which are actually, I think, are not really well understood. And that is an important issue, I think, particularly related to masculine role stereotypes. We've already talked about overcoming inhibitions a bit. Substances are obviously the main thing. But this very interesting question, which I don't really have any expertise in, but I think is a very interesting question about impulsivity and whether impulsivity is really a personality trait that everybody has to some degree, but only a few people have to a high degree, or whether impulsivity is something that tends to occur after early neuronal damage in the first 5 years, or whether it's a psychological problem. It's actually, or perhaps all of the above. And I think there's something, again, the language here is interesting about overcoming inhibitions to violence, which has a sort of slightly passive quality to it, or consciously constructing reasons to act. And I think that's interesting too. And for us as therapists, it's quite important how we put that formulation together, because, say, in general, the people who come to us will come with a narrative of how they were forced to act for a variety of reasons, and exploration of what that was like and whether they still think that's true, given that the court, of course, will have given them a message that that is not true. And of course, you see, there's something very interesting here for a therapist in which the patient has got a story, but the court has a story that it may be completely different, and the victim may have a story that's different again. And then other people who are working with a patient, if you're in a secure psychiatric setting, will have yet another narrative. And often one of my tasks is to try and put these narratives together and explore them. And this came out of a discussion I was having just in the prison this week, a rather startling statement: I feel in control when I have a knife in my hand. And this young woman actually spends a lot of time self-harming, very badly self-harming, but she's actually in prison because she committed a violent assault with a co-defendant, and her violence is gently escalating. So she's now looking at 8 years in prison, I expect, when she gets sentenced. And so we're trying to think with her about why her violence is escalating, why it's increasing. So one of the things that we think about is whether if violence is a communication, that violence is something that people do when they don't have language for challenging or painful feelings. That concept of alexithymia, the inability to put feelings into words, Again, very much a neuropsychiatric process, the ability to put feelings into words, something that we know is damaged, that we know that process is damaged by early childhood adversity. Very interesting early studies by Dante Sacchetti, which showed that children who'd been maltreated had less vocabulary for negative feelings than children who hadn't. So there's something about the inability to put horrible feelings into words, and whether that makes violence more likely in a type of, I'm going to physically act this out if I can't speak it. And this interesting question about violence, whether having a political message, or whether we might think about the embodiment of states of mind. So what happens afterwards? Well, some people will say that they just feel peace and relief, but also a sense of shame, and that's very similar to what addicts often say, of course, after binges or relapses. Some people, of course, describe amnesia and dissociation, and that is a process that usually takes quite a while to wear off, but it usually does. But it's not as very common for people to be amnesic for violence, often for the first few weeks. And that goes, of course, too with denial and minimization, and that, of course, is where the criminal justice process comes in. And it means that we tend not to do psychological work with people on remand or before trial, because it's impossible to really think seriously with people who've got a big trial coming up, who've got to mount a narrative that exonerates them. So it's very difficult, and we don't do that. We support people, but we try not to get involved in that process because it doesn't make any sense to do so. But I think that it is true that people are often very frightened to think about what they've done. And this quote at the bottom is not from an actual murderer, but from a fictitious murderer. But it is quite a good description, I think, of how people in the first weeks and months after a very violent offender are often afraid to think. And you might like to think what it might be like to be afraid to think. Post-traumatic phenomena, this is an interesting process that was really first described in the 70s in Vietnam vets. But the idea that the violence itself, violence perpetration itself, might be a type of trauma, most described in relation to domestic homicide, I think. And there are a few studies that suggest that it's possible to develop post-traumatic stress disorder after committing an offence yourself. There's no particular reason why it wouldn't be the case. It fulfills all the criteria. I think what's interesting is that it's not the norm, in a sense. But that's true for PTSD. Generally, PTSD is not the norm after trauma. So it's interesting that those people who do develop PTSD, and we don't have any really good understanding of why some people might develop PTSD after a murder and some people don't. Probably everybody has some post-traumatic phenomena for the first year, like any trauma, but it probably disappears after a while. It may be more likely in those people who are psychologically compromised already, but as I say, the data is not quite good enough. But obviously we do, that's something that you would work with too as part of therapy. I just want to spend a little bit of time just thinking about the development of an antisocial mind. Again, which I know that Adrian talked a bit about yesterday. But I guess that what I'm particularly interested in is this idea of a lack of epistemic trust. That is to say, this is a concept developed by Fonagy and Luyten, and it's the idea that you need to build up trust between people, type of socially based trust, in order to learn things. And that is crucial in the first 5, 10 years of life in order to develop not only an ability to learn, but also an ability to be curious. And if you can't do that, then it's going to be, and you also can't make trusting relationships with others, your affect regulation is going to be poor. So, this leads to a sort of fragmented and unstable sense of self. The absence of empathy is interesting because of the slightly mixed data about absence of empathy in offending. It's not as clear-cut as one might think. Although clearly some offenders lack empathy, not all do. So it's a complicated relationship. And of course we think that some offenders may have a heightened sense of empathy in terms of committing acts of cruelty, and that heightened sense of empathy may be a source of pleasure and satisfaction for them. I think we assume that the people that we work with, many of them have not grown a secure sense of self, and that somewhere, usually in the first 1,000 days of their development, there's been some impairment of the neuronal systems that are necessary. And that's particularly in the context of poor attachment relationships with people, with carers. So for most of us, that attachment relationship will be to our parents, but doesn't have to be a biological parent, it could be anybody. But the idea is that you need an attachment figure in order to develop a secure attachment system. And that attachment figure's mind is a very important part of what helps you to learn how to have a mind yourself. And that's just a reminder of just how fast the system is growing in the first few years of life, first few days and months and weeks of life. But that neuroplasticity is continuing on well into the second decade. So abuse and trauma are likely to have a very profound effect, and possibly a quite chaotic effect, in the sense that a small type of damage at the right time may cause disproportionately large effects in different systems later, depending on the other risk factors present. I'm sure you talked about this yesterday, but I think it's just worth rehearsing that there's increasing evidence that even before birth, maternal stress levels can affect genetic expression in neonates, that there's an impact, probably a negative impact, of having unregulated high levels of any neurotransmitter in the first 1,000 days. That's particularly in relation to noradrenaline. Because if you think about, for example, if you take a 3-year-old boy who's being constantly physically assaulted by his dad, or indeed his mum, or both, or indeed any other adults who happen to be wandering about the building, then this is a child who is going to be frightened most of the time. So very high levels of noradrenergic responding will lead eventually to a depletion of the cortisogenic response, and that has knock-on effects later on in how people manage stress. But it's that chronic fear that we think also leads to alteration in cell architecture, in the orbitofrontal cortex. And so I won't say more about that because you talked about it yesterday. But I think we're therefore particularly concerned about the early care, the early care of children, and what happens when you have babies and toddlers and small children who are in high states of arousal and agitation, because dissociation will probably only take you so far. Dissociation is a phenomenon that's probably not intended for long-term use, and long-term dissociation from feelings is probably harmful in its own right. You may have talked about this yesterday, and some of you will be very familiar with this literature. This is the literature on adverse childhood experiences. This has been going on now for some 20 years. These are the types of childhood adversity that we know are important in terms of long-term adult outcomes. So out of this data comes the evidence that the more childhood adversity you have, specifically if you have 4 or more different types of childhood adversity, you are at greatly increased risk of a range of negative adult outcomes. And that includes physical health, in fact, as much as mental health. And that's really where the interest in this started. But of course, where we might be interested is what it does in relation to violence. And this is the work of Baglivio and others in Florida, looking at young violent offenders in the correctional system there. And you won't be surprised to see, if you just look at the column on the right, that the juvenile offenders in Florida have had just far more childhood adversity than even the members of the Kaiser Permanente HMO, with a standard comparison. And a paper by the same group published at the end of 2015 by Fox found that the more childhood adversity you have, the more likely you were to be a severe, chronic and repetitive violent offender. And that each adverse childhood experience increased the risk of violence very significantly. And they postulate, as I'm sure was talked about yesterday, what the impact of chronic childhood adversity might be on the development of the orbitofrontal cortex. Other people have suggested that the problem with that childhood adversity is the impact on the development of the immune system. And that, of course, is quite interesting in terms of how the role of the immune system, in the development of neurocytoarchitecture in the frontal cortex. Still, or again, something that Professor Rain will have talked about yesterday. So I've been very influenced by the attachment literature, which of course builds on this. We know that childhood maltreatment tends to result in insecure attachments, disorganized attachment, but dismissing attachment is an attachment style that's characterized by derogation of need and vulnerability. So that links very much with the type of violent state of mind I've been talking about. And you won't be perhaps surprised to hear that such studies as there are have found quite high levels of dismissing attachment in violent offenders. And there's quite a number of studies of that. Other evidence about a really poor sense of self. This is something that we hear a lot about from patients, the sense of not really recognizing themselves. And Dante Sacchetti's group, again, this is an old paper now, finding that maltreated children reacted to their own image with hostility. Whereas if you have a secure attachment, you are able not only to think about your own mind, but the mind of others, and without anxiety. And you're able to think about feeling and feel about thinking in a regulated way. And you're also able to tell a more coherent story of yourself. So this is a bit of mentalizing in practice. This is from somebody in one of my homicide groups. Around 2 homicide groups, one for people who've killed somebody close to them, one for people who killed a stranger. This is Tim. I feel I'm stuck in my previous age, the age I was when I did my offence. He was 14. He tried to kill his entire family. Time's passing here and there are things I'm not doing. I want to capture time with magazines and pictures to know what I was doing when I was here. What will it be like in 10 years' time? Where will we be? What will I think on my deathbed about this time? So this is a young man very actively self-reflecting on what he might think or what he might not think about what was happening when he was younger, when he was committing his offence, and what he's doing now. It's interesting that he refers to his offence. Often very hard for people to use active verbs like when I killed somebody. So failure to develop mentalizing, you find a lack of a lexicon for negative feelings. People don't have the words. They don't use metaphors, and because they don't use metaphors, they find it difficult to articulate agency, often very sparse and derogatory narratives. And then people will literally say, I can't think, which I suspect is true. Often very difficult, I think, for people like us who think all the time to imagine what it might be like to not be able to think. So I'm just going to press on actually, I'm just conscious of time, so we have a bit of time for discussion. But the idea that, that if you can't mentalize, if you can't think about your own mind or the mind of others, then when you're anxious, your arousal is going to soar. And if you can't put those feelings into words, if you can't seek soothing from other people, then the physiological arousal alone may make you want to act. And substance misuse will only do so much. Let me just, the only thing I did want to say is that we do know that insecure attachment is a risk factor for violence. A meta-analysis by Ogilvy a couple of years ago. It's only one risk factor, and it's not more important than any of the others, but it looks as though it is a potent risk factor for violence. And that it would also particularly go to the issue of relational violence. It might not explain very much about drug cartel violence or terrorist violence, but it might be a very important aspect of relational violence, which, as we know, is one of the commonest. But it is undoubtedly true that there is plenty of violence, particularly relational violence, in fact, that's committed by people who are not antisocial and who don't appear to have insecure attachments. Domestic homicide is often the case. Family homicide is often committed by people who are otherwise pro-social and high-functioning. And violence may represent an emotional solution to an emotional problem, an unappealing but necessary solution. So just going on to think about what the treatment is, in the context of this group you may want to challenge the use of the word treatment, but I'm not suggesting for a moment we're treating the crime itself, but we're looking at changing the states of mind that underpin those acts of violence. And therapy is obviously an opportunity to explore relational things as well. Group therapy is a particularly potent way to think about antisocial states of mind, because you are, as it were, encouraging people to be pro-social just by being in the room with other folk and requiring them to take other people's minds seriously. And that can be very difficult for people. I'm remembering a man who said to me, "I don't want to be in a group with people like me," which is very, it's bleakly humorous but poignant, I think, and says saying something about how uncomfortable it might be to be him. I've already talked about how we formulate violence. We think about a sort of bicycle lock, about the numbers that have to be there. We talk about trying to articulate the part of people's minds that wants to hurt other people. We want to try and explore how other people come to be seen merely as a means. And I picked that phrase quite advisedly for the philosophers amongst you, because I think it's a very potent one and helpful when understanding violence. The maybe brief but definite satisfaction that there is in inflicting violence and hurt, and how people manage to get trust and security without excusing, giving people an experience of trust and security without providing with an excuse or forgiveness. And it is very poignant to work with people who clearly would like to be forgiven, but it's not possible. So, and that is very poignant when you meet it. And it is a place that therapists get into trouble. So the wonderful Marilyn Robinson, you live with your own mind all the time, so you ought to be comfortable there. Most of the people I work with are not comfortable in their own minds at all. I won't say any more about this, in fact, but I'll just say, because I want to give you some clinical material from a group, and then we can have some discussion. So it's characteristic for people to, at the start of their work, to minimize their own agency and ownership, and start with something like, it wasn't, often in extreme forms, it wasn't me. It wasn't me, I wasn't there. And that, of course, is where the defense will start, usually. And then, of course, once the trial over, it's not possible to say that anymore, or it is, but a lovely quote from one of our guys who didn't join the homicide group. He said, "I didn't kill anyone, you can dig him up and ask him if you don't believe me." Sort of work in progress. But characteristically, people will start from a position of denial and minimization, and they move to, well, it wasn't me, it was my illness, and I did it when I was mentally ill, and then they will say, I killed her. So it's a move. It's a move in terms of the narrative from a type of passivity to a type of agency. This is a quote, this is not from me, this is from Brookman. This is in a book about narratives of violence. I won't read it out, but if you look at it, you can see there's really quite pockets of incoherence in this narrative. And by incoherence, I don't mean it's not understandable. I mean, there are things that doesn't make sense. You can see this man actually doesn't, when the speaker doesn't finish all his sentences. There's something in this at the end, but at the time when I was actually doing the actual, putting everything else to one side, me, Flex, and him, the feeling of what I was doing, Now that is a nice example of incoherence of narrative. He killed somebody with an electric flex. Yeah, you got that. You can see he's trying to say something about what happened, but his language falls apart, presumably as his affects are rising. The anxiety is rising. So what you're trying to do is to help people like that develop a more coherent narrative in which they can own what they did. So that means building a secure base for people so that they can speak things that are very difficult to say and quite often quite difficult to hear. You have to try and help this person accept themselves without offering any type of redemption or forgiveness. You have to be quite careful about not reenacting toxic attachments, which is why I prefer group work. I don't do a lot of individual work with offenders. I think it's better in groups. You can use a variety of media and techniques, and the only reason I say that is because I don't really have time to talk about the use of the creative therapies, but they can be very important, particularly for people who lack symbolic function, people who had very extensive childhood traumas who haven't been able to learn how to use symbols at all. And groups are good because they're good for shame as well. Although people find them often quite difficult to start with, actually, paradoxically, you get quite quickly a reduction in anxiety and a sense of shame. And this is a quote from the homicide, from the family group. I imagine this group will go on forever. Maybe in 200 years it will still be going. So test me how old the therapists look. I think. So, this is from the Leavers group. The Leavers group has actually got a mixed group, but they were all violent offenders. Not having a structured day is a killer. I'm worried about this form I have to get. It's my P45 or something like that. In English, in the English social law system, P45 is the thing that you get when you leave your employment and go on to new employment. So it's a fascinating association in this man's mind that he's going to be leaving the secure hospital and he needs a P45 to leave his job as being a patient to start somewhere else. I'm fed up with myself. I don't want to be me. I want to leave that part of me behind. I'm living in hope of freedom from my mind. Probably a man with still a bit of work to do. And this is where I want to end. I've just got a longish sort of quote, but which I hope will demonstrate. This is a man who attending a mentalization-based therapy group. Again, all the people in this group have committed very severe acts of violence. Some of them have been mentally ill, very actively mentally ill at the time. I'm very grateful to this patient for giving me permission to share his material with you. So he's being asked, this is actually from his adult attachment interview before therapy. So he's asked about childhood disruptions, in this case parental divorce, and the interviewer is asking him about whether his carer is divorced. He was living with his grandmother and grandfather. And he said, well, I don't know if he divorced her or not, but all I know is that he left her, in a sense that he told her about his companion, as he called her. And to cut a long story short, I blamed him for her demise because the last flicker of flame in her belly had been extinguished. Now, this is a quite incoherent narrative. It's beautiful in some ways, and it's quite, in a sense, you can get the sense of it if you work at it, but there's something quite incoherent about it. It's quite a long run-on sentence, and this rather interesting metaphor at the end about a flicker of flame in her belly, which comes out of nowhere, really. It's not quite clear what he means. But I should say straight away, there's nothing about incoherence which is wrong or bad or pathological, only that he's trying to communicate something. It's not quite clear what's being said. So what did she do when she heard? Of course, after a year being married to him since childhood days, see aunts and all the rest of it, from back in the army days and all the rest of it. And I thought, well, he's responsible for her demise. I was just grieving so much I didn't know what to do, so I thought I would kill him. I'm probably glad he wasn't in, really. He wasn't in, so I got in through the back door at the side of the house and went to go and hang myself in a tree, but that didn't work, so I left. So again, that's one long run-on sentence. And this is the answer to the question, what did she do when she heard? Yeah, so you can see that this man has gone off onto a sort of reflection of his own, in which images of death emerge quite quickly. Both the idea that when you don't know what to do, you go and kill somebody, and that when you can't kill somebody, you can go and kill yourself. So these images of death emerge very swiftly into some questions about the past. And this man, in fact, killed a stranger in the street when he was psychotic. So one of the things that we think here in this case was that this is a man who was quite preoccupied with murderous thoughts from an early age. And you may not be able to read this very well, so I'll read it for you. This is the same speaker 18 months on, and he was being asked how he coped with his grandmother's death. So the same sort of bit of the interview. So quite early on in the interview, you ask about childhood disruptions. He was talking about his grandmother's death. Well, I almost had a breakdown. Well, it is a breakdown if you call it breakdown. First of all, I went to harm my granddad because he'd taken on a companion, and I found out before this, he told my grandmother while she was in hospital that he couldn't enjoy his retirement. My mother knew this. I said to her, why has he done this? And she said, I don't know. My grandmother died. I went to confront my grandfather with the intention of harming him, probably killing him actually at the time. And it wasn't him. Luckily for me and for him, I don't know what I would have done if I got there, if I'd actually carried it out. Obviously, I was very upset. I was really grief-stricken. I tried to hang myself in the garden. I broke into the garage and got some rope and tried to hang myself. And that is what happens when someone dies. I'm not talking about my index offence. I'm talking about as a child. So this man has now, I think, is much clearer in his mind about times and places. He makes a very clear distinction at the end for the interviewer about what was past, what was the index offence when he killed a stranger, and what was in relation to childhood. He is able to say something much more about, I was really grief-stricken. He's able to say much more about owning his own emotions. And he's also be able to make a slightly more coherent narrative about what happened with his grandfather, about how he went to kill his grandfather wasn't in, and so he was very distressed, and so he went to kill himself. So this is quite subtle narrative shifts, but significant. And that's the sort of thing that we're interested in. Again, there's much more of a sense of owning a type of action. So my last thoughts really are the ethical ones that I guess we're all interested in, which is, can we force people to become more pro-social? And does the state have a right to insist that you change your mind in a way that's consistent with other people's aims and objectives? Is it justifiable to withhold goods and liberty if people fail to make such a change? Which is, of course, what we currently do in prisons. If you don't make progress in relation to owning agency and responsibility, you won't achieve your liberty. And do we each have a right to be antisocial if we're prepared to take the consequences? And what would the exercise, the capacitous exercise of that right look like? And I'm going to conclude that violence is not normal. It needs attention, it's complex, and motives are rarely single or simple. And there is a remaining question about whether, if we deprive violence perpetrators of liberty, whether we have a duty to try and help them change their minds. And on that note, I'm going to close and have a bit of time for discussion.